All right, we are live with Kristie Wilson to understand exactly how CBD oil can help you or other ways to get into your body. Also, as you know, marijuana and CBD have been a big controversy about 10 years ago. Now, as we're back, now we're in 2024, Labor Day weekend, a lot of it is now we understand the benefits of it from a medical perspective to help our bodies stay healthy, get healthy if we want to. So I want Chris to understand with her background as a nurse practitioner first in critical care and now going to functional medicine, understanding how that works for the body, she has the knowledge medically how the body should work. So we want to understand with her knowledge, how did she progress and transition to holistic medicine and focusing on CBD and downlining mushrooms too to understand how the body works. So Christy, take it over. Tell me your background.
Hi, everybody. Yeah, so I have a background. I'm a registered nurse. I've been a registered nurse for 10 years. Primarily, my background was in critical care, adult critical care. And through my own personal journey, the last 4 years, I kind of dove into holistic medicine. How can we better our bodies without, relying on pharmaceutical medications, and how can we do that naturally? So I kind of went on my own personal journey of learning and educating. And then the beginning of this year, I linked arms with a company called Green Compass, who is right here in North Carolina, where I'm from. They have a CBD, organic CBD company, and just launched into the functional mushrooms. So we use those products to help create homeostasis within our bodies. And it has been a game changer for me personally.
And why did you switch from being a critical care nurse, and I'm sure if you still are a little part-time, to more of a holistic medicine? Why was that if you want to call it, needed for you?
So I believe that there is a balance between Western medicine and holistic medicine. I think that there are times where our Western medicine, technology, we've come a long ways. I think that there are plenty of things out there that need that. But I think that we've gotten so far away from the root of how to care for our bodies naturally that we're just kind of constantly putting band-aids on things and not getting to the root of the problem of why are our bodies feeling the pain? Why are we constantly in these anxious states? I think, dealing with mental health and things like that, I truly believe that those things can manifest in our body as physical ailments. And we're seeing more and more of that show up.
Well, and being critical care nurse too, did you see we're not actually fixing anything, we're kind of just band-aiding things, not getting people healthy? Maybe we put the arm back on, right? Maybe put the leg back on. Maybe we help them heal from a heart attack or heart issues. But after emergency care, what's to get to a higher quality of care, higher quality of life, just wasn't there for you?
Right. And being in the same area, you start seeing certain people kind of circulate, and you're like, it's a hamster wheel, right? So
wait a second,
yeah. So it's like, what are we doing to create a better life for yourself? You're just kind of on this like cycle of putting a band-aid over it, and then it just same thing repeats itself over and over again, instead of the goal is to create a better balance, right?
And when we get there, did it affect you physically and mentally not be able to get people to that next step?
Absolutely. Yeah. It's frustrating, right? Because first and foremost, like, people have to make the decision to change their lives for themselves, right? We are the only people that have control over those kind of decisions. So that can be frustrating in itself too, when people don't want to take responsibility for their health and their lives. But I think that society in a whole kind of tells you that this is the way that you'll get better. But is it really the way that you're going to, like, holistically, as a whole human, mentally, physically, everything, feel better? Or is this just like what has been told the last, many years.
Well, and thing is, a lot of it is you're probably my 15th, 20th nurse practitioner who has transitioned to holistic type of medicine in the sense where okay, I can get myself out, I know how to do it, but it's not how medicine wants people to get healthy in their sense of health, for one, too. So you're going down a next step of not only a happy career, a career you can be happy with for a long term, but getting people a next step of, hey, this is what health should be versus what the hospital or doctor or medical doctor might tell you, or the pharmaceutical company might tell you,
Right.
Which is almost the big picture, right?
Right. Absolutely.
Did you work in a private practice, or did you work in a hospital, or what, did you work in both?
So I've kind of worked in both. Right now,
Okay.
I'm in a pediatric office, so it's a little bit different. But primarily before that, I worked in a hospital setting in adult critical care. So I definitely have seen the side of medicine where it's necessary in emergency situations. Unfortunately, acute care, chronic things lead to, things that need the life-saving measures. So I understand the necessary need for it. But I think the thing that we're missing as a society is taking care of ourselves before we get to that point. Our body sends signals and red flags way before a chronic illness happens. And a lot of the time we're ignoring the red flags. Like our body is screaming at us way before that, and we're just like, I'll be quiet.
Good enough. Well, or even because I'm on the West Coast, maybe we have really slow medicine here. It's like, I'll make an appointment with your doctor in about 4 weeks. And it'll be a phone interview for about 10 seconds for one, too. Or do some lab work. We'll get back to doing lab work. Or my patient's being a chiropractor myself. I may want to get an MRI on somebody. They're that bad, that intense. I go, and the patient will tell me, I call my doctor. I see them first in 4 weeks. Then they refer me for another 4 weeks to a specialist. And the specialist can refer me maybe an MRI within probably 2 months. So it's not only is it the patient's, if you want to call it a procrastination, but also medicine sometimes, at least where I am, is where that procrastination also on their end. So you take the combination of both. The patient may have early signs of, say, a heart attack. By the time they get the medical care, they've already had a heart attack.
Yeah.
Well,
yeah.
And with yours too. Yeah. Is that same thing in North Carolina also?
Absolutely. It's unfortunate that a lot of these people are not pushed to the back burner, but it kind of feels that way sometimes. And then by the time they get help, it's like they're so far into the illness. It's like, what could we have done before that? I just feel like the focus has gone away from prevention.
Well, in that point, I see your passion to get people healthy now. Exactly how does CBD work from your private practice to now more of a holistic medicine type of practice?
Yeah, so I kind of separate the two, obviously.
Sure. Okay.
I kind of because I work for a pediatric office, and
Sure.
I don't really mix the two. But I do think that I relate a lot to mothers. I'm a single mom, and the reason why I started CBD in the first place, I started as a customer 2 years before I even was interested in the business. I was just kind of like desperate for, I was in that postpartum journey with anxiety, depression, a lot of grief at that time. And it was manifesting in my body. Like I was tired all the time. I had just gone through a radical change with my body, giving birth. And so I decided to try CBD. And the way it affected my life was incredible. And after taking it for 2 years and seeing what it could do for me personally, I was like, more people need to know about this. Because I was at that stage in my life where all of my friends were getting pregnant and I was seeing them go through it. And I'm like, a lot of women are going through this, and don't really talk about it even, And so I've just really done a lot of outreach in the community, reaching out to other mothers going through these types of things, to let them know that there are natural ways. Because the first thing that you're going to go to your OBGYN, and the first thing that they're going to suggest is probably a medication. And for me personally, that was just not the route that I wanted to take. I wanted something more natural, something that I didn't feel like I would rely on as heavily. And I feel like I found that with CBD.
It's almost like because you have medical background, people go, hey, she is in healthcare. Why did she go this route instead? And you're helping other new moms really not reinvent the wheel, and you're paying your knowledge forward.
Right.
That's what it comes down to, right? Too. And right now you said it for about 2 years. How's it affected you personally? I guess in general, what is the positive and sometimes the negative effects of CBD and maybe a combination with THC?
So there's definitely a stigma there with CBD. First and foremost, so CBD is derived from the hemp plant. So we have the hemp plant and the marijuana plant. And I like to refer to them as sister plants. So the difference here is the hemp plant is high in CBD, low in THC. Marijuana is the opposite, whereas it's high in THC, low in CBD. So that is what gives the marijuana plant the psychoactive effects that people, the high that people think they're going to get from CBD, which is not the case. So CBD, because it's low in THC, now I could go down even further. We have a broad spectrum and a full spectrum with a CBD that contains THC, but it's less than 0.03%. So the THC that is in the full spectrum, you won't even feel any psychoactive effects of that either.
So the hemp plant does have some THC, but
correct.
It's very minute
to
where there's no symptomatic effects. Okay, got it.
Right.
Okay.
And it can be extracted to the point of having no THC in your products. We have a broad spectrum product that has no THC in it at all.
Okay.
So there's a couple of things I think that people get hung up on with the CBD market, and rightfully so. Lack of understanding between the hemp and the marijuana plant. So they think it's all the same, and they're going to get high from it, which is not the case. And then,
dang it.
Right. The other one.
Knowledge is power, Kristi. That's the problem. Knowledge is power.
That is right. And then the other one is it is an unregulated market. So people get, so that's the hang up, right? So when you're picking a company, you want to make sure that it's trusted because it's an unregulated company. With Green Compass, we are the only certified organic USDA hemp company. So all of our products are third-party tested. They all have a barcode that you can, like a QR code that you can scan on the bottom of each label that pulls the chart. So you see exactly like we call it seed to soil or soil to seal. So
got it.
Where it's planted, you can see where it was extracted, the whole process up until it was bottled. So
did you say it's pharmaceutical certified?
It is third party tested.
Okay, third party tested. Okay, got it. Okay, good. They say it's close as you can getting to going through the stages of getting pharmaceutically certified by the government per se.
Right, and Green Compass, the executives sit on the round table with DC, trying to pass bills and laws and stuff for the hemp company. So I've just been, as a healthcare professional, I'm really impressed with the steps that they're taking and the science and the research being done. I really respect.
You're helping you're almost the company is helping hemp, if you want to call it producers overall in the U.S. get to higher certification, higher knowledge at the lobbyist level, at the government level. Hey, this actually is beneficial. Is there a problem when they do go to these meetings where the pharmaceutical companies go, hey, we still need to push our drugs too?
And I'm sure there are, but I honestly don't know exactly how the conversations are going. That's a good question. I would love to be a fly on the wall.
It's a competitive market. So how do you push something that may not have the billions of dollars that, say, a huge pharmaceutical company has, to go, hey, see us versus seeing them?
Right. And I'm sure there's going to be a fine balance there, but I would love to be a fly on the wall for those conversations.
And what have you seen in the community, and I guess in social norm, that has been the negative effects that people have, I guess, talked about or discussed, or maybe a misnomer of CBD?
I don't know that I've noticed what could be a negative effect. Is that your question?
Well, I would. My question and answer might be: you're getting from a different company that may be actually a regulated company that may be saying they have a high percentage of CBD, but it really does not. So at that point, they're getting something, say, from company B, and they're not getting the benefits that your company may have.
I see what you're saying. Absolutely. Because I don't know if you drive down the road here in North Carolina, you can see the green CBD signs at all local gas stations, and it's like, do you really want to be buying your CBD at a gas station?
I don't buy my hot dogs at a gas station. Why would I buy my CBD there?
Right. So let's back up and talk about how it's an unregulated market. So you want to be careful when you're choosing these products because it's unregulated. So anybody can put anything in a bottle and slap a label on it and say, here's CBD. And as a healthcare provider, that's scary. Yeah, that's scary. You don't want to just blindly trust anybody.
And in California, it's almost like they do regulate at a certain point because they want to tax it.
Right.
So they want to make sure they have more people out there, but you can still go to company B online, have lived to your house, from somewhere else, you know where it's from. They have a bunch of other chemicals, like anything, that make you feel like you're having CBD, just to give you that feeling, but not actually the benefit.
Yeah. And
it's massive.
And furthermore, they can claim, no THC and have massive amounts of THC in it. They don't have to be exactly honest. And that's where, as my healthcare background, I respect Green Compass so much because they do have that certified analysis breakdown of everything through the QR code. And I respect that because I can literally pull it up and see the entire breakdown. I'm like, okay, now this is trustworthy.
Well, it's almost like I need that link from you too for the Green Compass, for the show afterwards too. How does it also affect? You said it also affects the body system per se. What is the you say
it? Endocannabinoid system. And for the sake of that being a tongue twister, I'm going to say ECS.
Yes, please.
Okay. So everybody's body has an ECS. So I like to explain it like a parking lot. So you have all of these spaces, and those are your receptors. And our bodies naturally make endocannabinoids to fill these spaces. So each space, like, let's just label each parking spot: pain, anxiety, stress, inflammation, digestion, all of those things, right? And so some of them might have a car parked in the spot. So the car is like the endocannabinoid that your body creates. Well, some of us might be depleted and our body might not make enough. So enters CBD. So we might have some parking spots that are open: chronic pain, inflammation, anxiety, depression. Those parking spots might not have a car in them. They might be vacant. So when we take our CBD, that acts as that vehicle that fills that parking spot. And instead of feeling high like people think from marijuana, with CBD, you just feel the absence of. It's a beautiful thing, and it's kind of like, is that real? Until people experience it. And it can take up to 30 days to build in your system. But when people experience it, it's mind blowing.
Is it almost where that parking spot, if it's not filled, then it stimulates that condition per se?
Right. And it makes it
Okay.
worse almost. Like one of my customers, she has plantar fasciitis and has dealt with that for years and years and years. Like when she first came to me, she was actually saying she was having like 12 out of 10 pain with her feet. And she just was like, there's no way that I can even think about walking long distance, like, or walk around the block even. So she started on CBD now it was a little bit sooner than your average person, but within 2 weeks, she was saying her pain was down from a 12 out of 10 to a 4 out of 10. And she was like, I never in my life thought that I would be able to tolerate that kind of pain anymore. Like she was just like, I can walk around the block and not like focus on it. She was like, the pain is still there, but it's tolerable.
And this is something where she's probably taken medication for it before, done orthotics, done everything else she could, but that was still there. And I'm going to say it like, if you want to get more medical term or more of a higher level, if there's an opening for that receptor for her plantar fasciitis, it's been closed before. Now it's closed off. That receptor for pain has been closed off by the CBD. Now the pain can reduce. Now the body can heal.
Yeah. It allows her to do more therapy, more exercises to help it. I mean, just all around, it leads to better balance.
It's almost someone has, for example, anxiety. They're doing therapy. They're maybe taking some light meds. They might be doing some things to cope with their body. But at that point, that receptor is so far open, it can't reduce. So that CBD allows it to inhibit that point from if you want to call it medical term, that point the body can now use its own system to actually now function to get the body to rebalance itself. We talk about homeostasis. What it really is, if people don't know what it is, the body has better balance, then it can handle the stress of your day. That's the big picture. Then you can go, okay, that stress. I tell them, same thing. My patients is before you had the chronic pain, what were you doing? Did that make you upset, tired, angry? No. Now you have chronic pain 3 months, and now that stress of your life now affects your body. CBD allows you to now recover from that naturally. So then you can do the things like you had mentioned, the orthotics for plantar fasciitis, the therapy, chiropractic care, whatever it might be, get your body healthy again to get to a better state of health.
Yeah. And
okay, good.
Right. It's like, it all connects, right? Makes sense.
Good. Want to make sure. That's how I break it down to my patients is what's going on with your body. How do we as chiropractors help you? And sometimes with chiropractic or even just medicine in general, you may be outside my scope. I mean, I need an MRI to see what's going on. I may have you go see your orthopedist. You may have, if MRI says you have a torn disc, I go, what else can I do? And it might be beyond my scope of practice, but if someone's in chronic pain, their medication for so long, at that point, that's not working for them. Get something more natural. At that point, the body can actually accept that, reduce the pain, then start healing by doing stretches, therapy, physical therapy, mental therapy, whatever it might be, so the body can actually heal. With postpartum, how did that help you?
So
details.
I told you, so I told you that I really believe that your mental state manifests in physical things in your body. And not only did I go through, giving birth and your body changing in that way, I feel like I had always dealt with anxiety, but depression was new. Your body goes through a lot of hormonal changes. You're physically not the same, right after. So I just feel like mentally I was in a really dark place. And CBD kind of helped me even that out, which allowed me to kind of also get control over my physical self. I was just kind of in a place where I wasn't taking care of myself. I wasn't doing the fundamental basics, moving your body. Like, I feel like we underestimate moving our body and drinking water and getting sunlight. Like, those 3 things if I do that, I can take on the day.
Well, it's almost like once your body starts going down that rabbit hole of bad health, then visual somatic reflex will, as you know, will tell you now this cause manifests in your body as a pain here, a headache here, an arm pain here for one too. So you start getting medication for this, either the problem's here. So now that I tell my patients, ask them, are you feel overstressed from your chronic pain? Yes. Sometimes you feel anxious. Yes. Sometimes it has led to depression. Yes. It's like boom, boom, boom. So how do you reverse that to okay? I tell them, I always ask them too. Didn't you have this problem too? Do you have insomnia when you had the postpartum?
I did.
Besides having a new baby, obviously.
Right, of course, yeah.
Yeah. Besides the normal stuff.
Yes, insomnia was a bad one. Waking up frequently, not being able to fall asleep, or when I did fall asleep, just not feeling rested ever. Kind of like you might sleep, but your brain doesn't. Feeling.
Remember talk about fight or flight too, that type of system for one also. I always correlate that with also just my thing, my patients is you're in a stress state. Yeah. Let's get you out of that so you can actually sleep better. I go, I don't care about your back pain right now or neck pain right now or what's going on with your body physically. If you can sleep better, that tells me your body's getting to a relaxed state. Let's get you there first. Has CBD helped that insomnia part of chronic pain too?
Oh, absolutely. I feel like CBD helped me be able to sleep better. I don't have that brain fog that I was experiencing. And like I said, it kind of just helped me like even out my mood to where I felt motivated to do the basics.
There we go.
It was the motivation that I was lacking, right? Because I was stuck in that state of depression. And it allowed me to kind of be like, okay, get a hold of yourself and regroup. And then it was just kind of like a trickle effect from there. When you start moving your body, I started feeling like myself again, and it just
you start doing the natural healing issue because now this wasn't in the way.
Right. So
that's part of it. And with Green Compass, how do they train you to be an advocate or affiliate with them?
So there's lots of training. We just had a conference back in July where we actually got educated by the chief medical officer, which was really cool. He did a whole seminar, and then probably 5 times a week, there are calls and stuff that they're always producing with new education and information. And they give us education as they're learning too, because they're constantly doing research and learning new things and stuff. So I really appreciate that aspect of it.
And how does that help you communicate the process of CBD benefits for medical conditions better? Their training.
Well, so I use my personal testimony to connect to women who have stories similar to mine. But another thing that I love about the community that we have here, there's a lot of pharmacists, nurse practitioners, energy healers, chiropractors, holistic, all kinds of different practitioners that are also advocates, and we all kind of communicate with each other. So if we ever have somebody that comes to us with a question or something that we just haven't seen, we reach out to our community and somebody is able to help us kind of get those answers and questions and stuff. And if not, then we also have corporate support. So I love having all that knowledge at my fingertips all the time.
We have the knowledge, as you know, being when you call someone an expert, the knowledge plus experience of your own personal experience the last 4 years, but also experience of people that have been there for longer or different experiences to help pick their brains too.
Yeah.
Again, I never want to reinvent the wheel. I always want to pay it forward. So why not get that community going more and more and more as you have been to get more people to understand Green Compass, either East Coast, West Coast. Is it mostly local on the East Coast right now, or where is Green Compass located?
The name is actually Green Compass Global. So like they have to eventually expand it globally. Right now it's just in the United States. We do have some over on the West Coast and the middle parts but a lot on the East Coast because it is from North Carolina.
Oh, you guys are all local over there. Got it.
Yeah, but we're moving over to the West Coast.
That's one thing, and a lot of it is it also affected by, I guess, people being regulated per state too. Has that been an issue?
I know that that's been an issue of why it's primarily in the United States. And I want to say, because we're a 5-year-old company, I don't know if that was an issue at the beginning, but as of right now, it's not been an issue. Shipping to all 50 states has been fine, and no problem there.
Good. Sometimes some states are more regulated, some are not. So as long as it's not a problem, you're good to go. Yeah. So for yours, if I had a client in California, hey, look, they're looking for some chronic pain relief. Kristie, is that a problem shipping to or talking to someone or shipping to California?
No, absolutely not. What we could do is, me and you could talk back and forth what we feel like would be the best for the patient. And then I could send them a virtual link and they would just purchase everything online and it would ship directly to them.
And what kind of products do you guys offer at Compass Global?
So we have oil tinctures, CBD oil tinctures, as well as our nano jellies. I specifically want to hit on the word nano jellies. They're different through a nano emulsification process. So it's different than your average gummy. Your body is actually able to absorb more of the CBD because of the nanotechnology that it goes through. Got it. That is as far as science as I can go into that, because chemistry.
Yeah, don't go crazy. That's good enough. It's basically, I want to say, would you say a higher concentration, higher absorption rate because it's a nanotechnology?
Right. So your body is getting more of the CBD than you would from just like your average gummy. And that's my personal favorite. I like our nano gel best.
Okay. What was the first one you had mentioned?
The oil tinctures. So if you don't like, some people like the texture of a jelly or a gummy type thing. So they prefer oil, which is just in a bottle with a dropper.
Got it. So you put it in your mouth, basically? Okay.
Yep.
Got it. Okay, I don't know.
Yep.
Sorry, I'm naive. I'm not sure. On your tongue. Perfect.
So those are our two CBD products that are the most popular. And then we did hit on pain relief. So I do want to talk about our relief cream. That is one of the things that the customer that has the plantar fasciitis, she started on, and that is like her saving grace. It is also our fastest acting relief. So whereas like
you rub right on the skin then, correct?
And you immediately will have some sort of relief. It also has menthol in it.
That's awesome.
Yeah.
And we all know the skin has different layers of skin, but also is connected to your bloodstream. So it goes right to your bloodstream also.
Right.
Perfect. Good. And I mean the tongue, same thing too. Bloodstream also. The gummies also through your stomach, it absorbs that way. So getting to your bloodstream, I think, is the key. Has there been any, if you want to call it, not side effects of it, or people taking too much, or what's your dosage you recommend for people to start with, or how does that work?
So we always recommend what we call the low and slow method. So when you first get your jellies or your oil, we recommend starting with a quarter of a dropper or a half of a jelly is what I always recommend to all of my customers. And when you purchase with me, I'm checking in typically. Some people don't really want the check-in, and so, but if you really want the dosing information, I follow up with you, after 5 days. How are you feeling? Then we might up your dose according to kind of how your body is feeling and what your response is there. But
that is the most important thing, I think, is the support. How do you feel from it? Should we, and almost like anything, right? Should we increase the dose or keep it the same? Where are we for 1, 2? That would help someone reduce the anxiety of taking something new that is considered, I don't know, that's going to affect me.
Right.
Good.
That's why I think it's important to start at a lower rate. And that's why I do think that when people choose this method, to have a mindset of knowing that this isn't like a quick fix. This isn't going to be like the pharmaceutical where you take it and you immediately, it's going to be some time to like have to build up in your system. You're going to have to play around with the dosing to get it just right. But once you do find that sweet spot, it's so worth it.
In about 30 days, correct?
Yeah, it can take up to 30 days to really take effect in your body.
Good. All right. Anything I missed on the show that I should have asked?
No, I think we covered everything. I don't know how we covered everything in 30 minutes, but I think we did.
It's you know your stuff. That's well, you know your stuff, Kristie. That's the thing. You know your stuff. You're not like, okay, so I get notes there just because you weren't sure what I was going to ask, but you know your stuff.
Well, thank you. I appreciate that.
Good. And then if you can send me a link of the Green Compass if you have your own link too for one also.
Yeah.
And so that when they can look at that information and get back to you on your Instagram exactly how do I work this? I have some chronic pain. I have patients that in my head I could think of that need some type of extra help that they can't get with medicine.
Absolutely. Yeah.
Are there any, and unlike prescribed medication, are there any side effects you've heard of from your community through Green Compass Global that have been an issue?
The only thing that I have heard is we touched briefly on the broad spectrum and the full spectrum.
Okay.
So the difference there is one contains the 0.03% THC. Okay. I have heard some people have tried those before and they feel like it makes them sleepy or a little groggy or just like they feel a little too much in their body. So for customers who are more sensitive in that sense, I always start them off on a broad spectrum to see how they feel first. If they want to try the full spectrum ones that contain the THC, they can, but you really have to know your body and how sensitive you are to different things. So my safe bet is I always start people off on a broad spectrum.
Well, it's almost everyone, like you said, everyone's body chemistry is different. No one's the same. So how do we understand it's going to affect you by having the support, like you had mentioned? Hey, how do you feel? Like, I felt a little sleepy, felt a little droggy. Okay, switch you over here. Boom, quick change versus hey, look, I'll see you in 30 days. Let me know what's going on. No, it's almost like that'll tell someone, didn't work for me, blah, blah, blah. You're getting people to actually get the benefit, support to help you now adjust the first 30 days to get your sweet spot. As they improve also, then you can change your dose even more and see where you are. You know, so at that point, get someone to really get the benefit of using it, but also when someone has less questions in their head, they get all their questions answered, less anxiety also. If they already have anxiety, you want to also reduce anxiety, not make it worse.
Yeah. It makes everybody feel more comfortable and confident moving forward, making the best decisions. So, yeah.
That's the plan. So ending the show now too, Kristie, what do you want my audience, which we talked about topics before too, to understand the benefits of CBD?
So for me, the big takeaway is if you're looking for something that is natural, not a quick fix, you really want like a lifestyle change, CBD could be for you. It helps mental wellness, physical, all of the things. So it's been life-changing for me. So I definitely think if any of this resonates with any of your audience, it's worth giving it a try.
And having the support that you would give them as they would start on something like that, even just answer the questions. Haven't started anything yet. Just want some questions answered. Then takes away the anxiety.
Yes, absolutely. I'm always open. My DMs are always open for any questions, even if you don't think that you're ready to purchase or anything like that. You just want to pick my brain. Please send me a message. I'm happy to kind of talk with you, anybody, what they're going through, and we can kind of figure out where to go from there. Because like we said, everything's so individualized for each person. So I kind of like to learn, what you're going through and then kind of lead from there.
That's it. One quick smile for the thumbnail. Boom, boom, boom. And we're good to go. All right. I'll stay there for 1 second. I'm going to end the show, but thanks for watching, guys. Let's go in the back office or the back area.
Okay.